Sarah, why should I choose a pressure care mattress?
In this video, I will teach you why.
Hello everyone and welcome back to the functional OT. Today I have a special guest, Sarah. Sarah is an amazing OT working for ILS, one of the biggest equipment provider in Australia. She has a lot of experience in mattresses and pressure care, and she's probably the best educator to give you all of the information about mattresses. Hi Sarah.
Hi Gianluca, thank you for having me today.
Can you please explain the key features and the benefits of pressure care mattress instead of a normal mattress?
Well, a normal mattress, it doesn't have any qualities that prevent pressure injuries, and you can't use a normal mattress on a profiling bed. So pressure care mattresses can be used on a profiling bed, and they work to mitigate all the things that cause pressure injuries. So pressure injuries have two causes and one influencer. So pressure, of course, causes pressure injuries, and that's pressure coming down from the weight of the body with gravity, and it's pressure coming up from the support surface, and the skin and tissue get sandwiched between the two. And then you've got the impact of shearing forces as well. And so that shearing force is like a parallel force on the skin and tissue. So you can imagine, when someone puts the head of the bed up, and friction holds the skin of the torso to the head of the bed, but gravity causes the skeleton to slide down the bed, and that real distortion, that force is called shearing force, and that greatly contributes to pressure injuries. And then the influence of a pressure injuries is microclimate, which is how much heat and moisture builds up in the skin and tissue. So our pressure care mattresses are there to relieve the pressure, to mitigate shearing forces, and to manage microclimate.
What are the primary factors to consider when selecting a pressure care mattress for facilities or home care setting?
Sure, well, when you're selecting a pressure care mattress for a facility, it needs to be appropriate for multi-patient use. So it needs to be easily cleaned between patients and probably have an incontinence style cover. And usually in a facility, there's not much choice. So most facilities that I've worked in will have, say, a static foam pressure care mattress for someone who's at the lower end of risk for pressure injury, and they'll have an alternating air mattress for someone at the higher end of risk. And some will have a hybrid in between, but not many. So there's not much choice. If you're a lower end of risk, you get put on one particular mattress. If you're a high end of risk, you get put on one particular mattress. And so the patient doesn't get a choice of what they're on. In the home care setting, there's a lot more choice. There's a whole range of different types of static foam mattresses that are pressure care mattresses. There's a whole range of hybrid mattresses. There's a whole range of alternating air. And so in the home care setting, it's not just pressure care that becomes really important. It is someone's comfort and their quality of sleep. And so they kind of marry up to being equally as important in the home care environment. Where in a facility, preventing pressure injuries is the #1 priority, because no facility wants an increase in the incidence of pressure injuries. And that's how it sort of differs of what you're looking at with your qualities of the mattresses.
How do pressure care mattresses contribute to the prevention and the management of pressure ulcers or body sores?
A pressure care mattress is one tool we have in our toolbox when it comes to the prevention of pressure injuries, and it's probably the most important tool. And what you put somebody on, what they lie on, it's really important. And it's important for all the reasons that we've already spoken about, to sort of mitigate pressure and shear and to manage microclimate. But something we haven't spoken about yet is the importance of enabling bed mobility. So someone can adjust their position in bed. It's really important that it's easy for them to do that, because that's a hallmark of pressure care, is to keep people moving. And so bed mobility is really important, and you'll get better bed mobility with something like a static foam pressure care mattress than what you'll most likely get with an alternating air mattress. So that's a consideration. When it comes to, relieving pressure, the main way our pressure care mattresses do that is through something called immersion and envelopment, which is a fancy way of saying the patient will sink into the mattress, and the mattress will conform to their body and, come around them. And so that sinking in and that conforming increases the surface area of the contact of the body with the mattress. And that increased surface area means we can disperse their body weight pressure, away from those high-risk bony prominences. So that's the main thing that the mattresses are doing. But when it comes to relieving pressure, and you've got a patient who is at the higher end of risk, we have our alternating air mattresses that provide offloading, where you'll have a cell drop down, and where it drops down, the tissue will be free of pressure and the blood can get back in to keep that tissue alive and healthy. When it comes to mitigating shear, that's usually in the cover of the mattress. So pressure care mattresses have multi-directional stretch covers. 2 or 4-way stretch. 4-way is better. And that means when someone is moving around in bed, or they put the head of the bed up, the cover's going to move with them to help prevent some of those shearing forces and that friction as well. Some mattresses are designed to prevent shear from deeper within the mattress. So it's something to look at. How does the mattress prevent shear? And then of course the microclimate management. We want to keep our client's skin cool and dry to prevent pressure damage. And so we do that through having vapor permeable covers, the ability to wick away the moisture and the heat away from the person and to create airflow around them. And so that's what the mattresses are doing to prevent pressure injuries.
Would you mind to tell us a bit more about the different types of pressure redistribution systems used in pressure care mattresses and their effectiveness?
So there are a range of different types of pressure distribution mattresses on the market. So starting at the sort of lower end of risk, you're looking at your static foam types of mattresses, and they really work to enable immersion and envelopment into the foam. And that foam needs to be breathable, needs to have a cover that's stretchy, there needs to have, some airflow. And then you have your hybrid style mattresses. So they are usually a combination of foam and air, and they can be non-powered or they can be powered. So the non-powered ones normally have like an air bladder with a foam core, and then your powered hybrid can have alternating air cells with foam over the top of the air cells. And those hybrid versions tend to increase comfort when you're still achieving a high level of pressure care. And then you have your alternating air mattresses. So these range in, cycle times, cycle types. So you can have like 1 in 2 cell cycle, 1 in 3, 1 in 4. The air mattresses are for those higher end risk patients who have more immobility because they need the tissue reperfusion from the cells dropping down, and they tend to have a lot of features to manage shear and microclimate.
I hope you enjoyed the video. Guys, we are gonna post soon also another video where we will give you our best mattresses options. Don't miss it out. Super important, don't forget to be kind and smile. Thank you so much, and arrivederci.
Sorry, okay.
Thank you so much, and arrivederci.